Okay, let's go.
So, I think you have that.
Okay.
We wanted to know what was your position on stem cells research?
Just in general?
Yeah, in general.
Okay, so stem cells, we do need to make clear what kind of stem cell.
Well,
And-
embryonic and adult.
Right, and then there's that intermediate kind, if you're not aware, the IPS, the induced stem cell now, they kind of fall in between. Our position would be against embryonic for a couple of reasons. One being that you have to destroy a young human embryo to get embryonic stem cells. And I realize different people take different positions in terms of the value of embryonic human life later on and so on. Our position is we value all human life from conception to natural death. And so ethically we have a problem with embryonic. We're fine with adult stem cells because you don't have to harm or destroy the donor. Very often it's yourself, over 50% of the cases. You can donate your own bone marrow, or even liposuction fat has adult stem cells in it, or a matched donor that you don't have to harm. The other problem with embryonic, and it's a practical problem with this intermediate, these induced stem cells as well, is that they're hard to control. They tend to make tumors. And so there's a practical problem in being able to get them to tame down and use them to actually treat a patient. At this point in time, there are only a handful of people who've been injected with embryonic stem cells. It's barely over a year's time, so we don't know if they're safe. There's some indications they may not be, so we'll have to see how that goes. And that practical problem and getting the right cell type is a practical problem with both embryonic and iPS cells that you don't have with adult stem cells.
Thank you.
Long-winded answer.
How did you personally get involved in the organization,
In this organization, I was a professor, a university professor for about 20 years at Indiana State University, and also I taught at Indiana University Medical School that had a branch campus on the Indiana State campus. And, in the 90s, I guess, I had a friend who got elected to Congress and started calling me with science questions. And a typical congressman, 2-minute phone briefing on just tell me quick answers sort of things. That's the way, unfortunately, a lot of public policy is done. They just want the bullet points. So, I would get these calls, and one of the calls had to do with stem cells and cloning, because that was hot in the 90s in terms of a topic. And then he asked me to come give some briefings in Washington, D.C., and a lot of organizations, including Family Research Council, would ask me to brief them or help with some of their writings and so on. Over the years, it just sort of snowballed, and finally the president of FRC just called up, it's been about 8 years ago now, and said, how would you like to do this full-time, do briefings and so on, and that's how I came here.
Have there been any defining moments where you knew this was the cause, you wanted to fight for?
I don't know if there's been just one or two. There have been a number of them where it's almost like being in a classroom where you're giving a lecture and you see the student get it. And whether it was a legislature up here on Capitol Hill, or out in some of the states, or just talking to people out, give these kind of lectures not just in the U.S. but internationally, and have people go, okay, I understand these basic concepts, and not just the ethical but the practical aspects of stem cells, and how we could help patients now with the adult stem cells and not have to cross any sort of ethical boundaries. So there have been a number of those over the years that, it's kind of those, it's their aha moment, but it's also where I felt, yeah, I'm at the right place where I'm supposed to be.
Did you personally know? Oh, I'm sorry. Did you personally know anyone who benefited from stem cells before you worked with this organization?
Before this organization, there were a few, because I've been talking about this issue and briefing people for, probably about 15 years now, and I've been here not quite 8 years. And so there was an older lady who had a particular type of cancer called multiple myeloma, who had her own adult stem cells, lasted chemo to kill the cancer, and then got her own bone marrow adult stem cells back, and went for years without any signs of cancer. I've met a couple of folks even before I came to FRC who had spinal cord injuries that were now walking again. Not as a cure, it's still experimental in a lot of cases, and that's one. But while they're not running any marathons, they are able to move and feel and walk with the aid of braces or a walker now. A gentleman who had multiple sclerosis and was treated again with his own adult stem cells, and has gone, I think it's 8 years now, or 9, without any symptoms of MS. And so there were a lot of folks that I met, even before I came to FRC, that had benefited from adult stem cells. Maybe not surprising, because what we call bone marrow transplants or stem cell transplants are adult stem cells. And we've been doing those for several decades now. It's only in the last 15 years probably that people have realized that they're adult stem cells in the bone marrow that are responsible for that. But there are, according to the Journal of the American Medical Association, over 50,000 people a year get these adult stem cell transplants. So it's becoming pretty easy to bump into somebody who's benefited from adult stem cells.
Why did you get involved with this organization?
I saw it as an opportunity really to promote good science and ethical science. It gave a platform beyond just being at the university to teach people about these issues, and also to weigh in terms of the public policy, whether it's at the federal level or in various states. I've probably testified in about half of the states, and probably about over a dozen international countries in terms of their legislation, trying to get good, solid legislation on the books.
I think the next question we had answered that. Our next question was, how did you originally find out about the organization?
Yeah, it was a matter of, they came to me because they wanted briefings on stem cells and what's the science involved, what's the ethics involved, what are the issues, and so on. And a lot of organizations did that over the years, and it just happened then that this one decided to offer me a full-time job too. Who's next?
I can. Well, we were going to ask what were the advantages of embryonic stem cells over adult stem cells, or adult over embryonic?
I frankly don't think there are any advantages of embryonic, period. There are obviously ethical problems, and that's where most of the debate focuses. But there are significant practical problems with embryonic stem cells in terms of being able to grow the cells and keep them growing for a long time. They are a very finicky cell to grow in the lab. And then getting them to do what you want them to do. If I've had a heart attack, I want heart cells to repair that damage in my heart. But it's very difficult to channel embryonic stem cells down to where they will become the kind of cell you want. You can just let them spontaneously change in a dish, and you'll get all kinds of different cells in a mixture. But that doesn't help you in terms of actually treating somebody. It might be interesting as a scientific oddity. But being able to get the cell that you want, whether it's heart, nerve, liver, insulin-secreting cell, is difficult to train these cells and to stop them from growing. One of the biggest problems is potential tumor formation. And even in animal studies where they have what they thought was 100% pure population, none of these cells are growing, put them in the rats, and 10 weeks later, the cells start to grow again. So there's always that risk with them. The adult stem cells, I do think, have all the advantages. Like I said, over half the cases with real patients, you can use your own adult stem cells. You don't worry about transplant rejection. You don't worry about tumor formation with adult stem cells. Get a good match. If you can't use your own, get a good donor match. Umbilical cord blood is rich with adult stem cells. We're throwing most of those away after babies are born. We ought to be banking those. And actually, the New York Blood Center was one of the first places to bank cord blood for other people to use, and where they first did one of the first adult transplants. Because usually we used to think that you want to get a little blood out of umbilical cords, you want to treat a little person like a baby. And that's where they did the first adult transplants. And one of those first leukemia patients was another one of these that I met years ago. That was, I think, 15 or 16 years ago he got his transplant. He's still going strong after they told him he only had 6 months to live. You can use them now not just for cancer treatments, but for autoimmune diseases like juvenile diabetes, multiple sclerosis, rheumatoid arthritis. Again, a lot of that's still in progress, but there are dozens, if not hundreds, of patients that have been treated for that. And then heart damage, stroke, spinal cord injury we mentioned. And there are dozens of cases where the adult stem cells are already bearing fruit in real patients, helping them, but without any ethical or tumor or matching problems.
Well, I know you mentioned that adult stem cells can help cure cancer and stuff. But if you go to hospitals, what are the main things you can actually use it? Like, what is it effectively being used?
For years, what they've done primarily has been cancers and anemias, and the basic situation is similar. Whether it's
Leo Johnson, keys out extension 3033. Leo Johnson, keys out extension 3033.
Whether they're treating something like a leukemia or breast cancer or something like severe anemia or even sickle cell anemia, what they will do is get their sample of adult stem cells, and then the patient gets a blast of chemo, and they've been able to work that back so it's not quite as bad, but the idea is you're killing the cancer or you're killing the bad bone marrow that's making or not making your blood cells, the reason you have anemia. And then you'll get basically just an IV drip of the adult stem cells. Those are becoming very common to at least more common. So you can go to most major medical centers and get lots of different types of cancer treatments or anemia. Sickle cell, there aren't as many, but it is a type of treatment where they actually have used the word cure in the medical literature. For some things more like, say, multiple sclerosis, juvenile diabetes, in the U.S., there are probably only a small handful of places where you're going to go and get that kind of treatment. It's not widely available yet. The same could be said about heart treatments, but there are probably at least 8 or 10 places in the U.S. now where they're doing treatments after a heart attack, even long-term heart damage. Down to, let's say, spinal cord injury, there are probably only a couple of places in the world where it's validated treatment. And again, here's sort of a caution, no matter what, whether it's stem cell or other kind of treatment. If you're going out on the internet and just saying, hey, I want a stem cell treatment for, pick a disease, you'll find lots of hits out there and lots of clinics that will promise you lots of things for a nice fee. You have to be very careful as a patient or a caregiver or even a doctor to do due diligence, because there's a lot of snake oil out there. And especially the offshore clinics. There are some that are very good, but people need to be aware and ask those clinics whether they are doing approved treatments, whether they've got the background, they've done the test, they know this works, whether it's in animal studies or other patients, whether they've published their results, whether they've got FDA approval or their country's approval, and so on. With spinal cord injury, there are a couple of places around the globe that are doing those treatments now that have all those approvals, publications, and so on. And then there are places that will make promises but don't have the backup. So there are, you get a range of, some of these things are commonly available, there are some places, you have to look for them, some there may only be one or two places around the world.
So, knowing that you're against the use of embryonic stem cell research, would you say we should discontinue the current use of stem cell lines, basically?
The formerly approved lines or the currently approved lines, I don't think we should be using them. I certainly don't think there should be taxpayer funding of that kind of research, whether that's federal or state. Obviously, it's legal to do certain approved lines and get federal funding at this point in time. In various states, some have approvals, some don't allow that use for their funding. A very mixed bag at the state level as well as international. My opinion would be, at least at the federal level, I'd like to see my taxpayer funds go towards things that are really going to help patients now and in the near future. And that's adult stem cells, not embryonic.
Another question would be, would you say that a doctor, any physician really has the right to say, based off of his or her religious views, moral views, ethic views, anything around that, can refuse a patient any type of stem cell therapy?
I think at this point, yeah, I think doctors, healthcare workers do have rights of conscience in terms of treatment, not just with stem cells, but any type of treatment, as long as if it's not a life-threatening condition at that moment, you've got to take some sort of action, even if it might contravene your principles, whether these are ethical or religious or whatever. But that's a pretty rare situation where there might be something you have to do immediately to save the patient's life, and it has to be against your principles. Patients should also be fully informed of what type of treatments they're getting. So if a doctor came to me and said, hey, I'm going to treat you for whatever it is with stem cells, I would want to know where they got the stem cells, what type of stem cells they're using, because I would not want to be treated with embryonic stem cells for both ethical and practical reasons.
Would you say, like, you not liking embryonic stem cells was mainly ethical reasons, or no?
I think it's about 50-50 at this point. If you had to weight it one way or the other, it's probably more ethical. But that's also an ethical question about whether you're going to continue a line of research or attempt to treat a patient with something that has significant problems, and especially when there is an alternative, a viable alternative that's already shown positive results. It's like you're going to endanger the patient's life even when there is a non-threatening treatment that could work.
Do you know of any more useful function for the embryos that might otherwise become aborted instead of putting them towards research?
Well, and it's not really abortion because they haven't been implanted. The ones that are the focus right now are the so-called frozen embryos. couple goes to the IVF clinic. Typical practice, at least in the U.S., is that they superovulate the woman so that instead of 1 or 2 eggs, there are 10 or 20 or 30. And then they will tend to fertilize them all, so then you've got 10 or 20 or 30 embryos. Well, you don't implant all those into the womb. 2, 3, up to 6, but it tends to be 1 to 3 nowadays because they're better in terms of their technique.